Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video about testing for for chronic infections, including persistent borreliosis and co-infections, and we'll wrap viral infections into there as well. So the video that I posted yesterday talked about certain laboratory options, testing through antibodies, testing through a T cell response through something called an ELISpot test, testing for the presence of DNA of the microbes through doing something called PCR testing. And I mentioned in that video that each of those tests has certain there's differences between them, and they kind of tell you whether they're positive or negative, tell you different things about what might be going on in terms of an infectious burden in a person's body. As I alluded to in that video, these tests unfortunately are not 100% perfect. They haven't necessarily been subjected to rigorous reproducibility studies. We don't know exactly what the exact false positive and false negative rates are for every type of infection out there. We do have some data more around Borrelia than any others. And so what we're really left with is these testing methods that are imperfect. They will hopefully be subject to more rigorous studies in the future, or to any study in the future in some cases. But right now, they're really more of like a functional tool that clinicians can use. And as I mentioned in my video yesterday, I do find those tests to be useful, but they are not perfect. And so another option that exists is doing something called a therapeutic trial. And a therapeutic trial is basically where the patient comes into my office and they tell me their history and their symptoms and whatnot. And if it sounds like there may very well be a infectious component to their case, like, I had a tick bite, a bullseye rash, I had the classic symptoms of Lyme disease, I went on antibiotics and I didn't get 100% better and I'm still sick months or years later, that would be a pretty compelling history for me to think maybe you've got persistent borreliosis. Or if a patient said, I went down to, say, the Dominican Republic and I got a bunch of sandfly bites and I came back home, and within a few weeks I was suffering from all these fatigue and brain fog and neuropathy symptoms, particularly burning sensations in my feet and severe headaches, and my lymph nodes are swollen, and I've got these longitudinal striae, so kind of looking like cat scratch marks on my torso. It's like, well, I have a suspicion that you might have picked up some Bartonella. You might be dealing with Bartonellosis. And then, of course, for other co-infections or whatnot, there's other things that might be going on, such as, I had mono when I was, 13, and then never really fully recovered from that. And over the course of time, I've just kind of become like sicker and sicker, and now I've got a chronic fatigue type picture. I'd be really suspicious that there might be a viral component, like maybe a reactivation, or possibly a chronic Epstein-Barr virus. So if the clinical history fits, and then one option is to do a therapeutic trial, to say, well, let's treat you as if you have the infection. We might not, we don't have that piece of paper, that test result saying that, yes, there's evidence that there is infection. But if the history fits, then putting a patient on a treatment for those infectious microbes is something that is an option. And so what that would look like in my practice, at least, depending on the case and all of that. But what I generally recommend is having the patient build up fairly rapidly, depending on their level of sensitivity and how sick and debilitated they are when they first come in, but over the span of, say, a week or two, kind of building up to a full therapeutic dose of the herbs or other agents that I would recommend that they work with, if we knew that, yes, you've very likely or definitely, based on test results, do have this or that infection. And so if they build up on the protocol that we'd be using to treat that microbe, and they feel either better as we're killing off the microbes, or they feel worse initially because they're herxing, then either one of those clinical responses tells me as a clinician, we're probably barking up the right tree by going after infection, because if they didn't have an infection, then in all likelihood they just wouldn't have any response whatsoever to those herbs or whatever the treatment happened to be. So what I have found is that by doing a therapeutic trial like that, it is very fast, because you just start the protocol right away. We don't have to wait for test results to come back. It's also markedly less expensive than doing testing because the private lab testing is expensive by anyone's measure. It's usually at least a few hundred, if not several $100s to get a even basic panel of different microbes tested for. And so where it's faster and markedly less expensive, and the safety profile in my experience is very, very good. When we're using herbs in particular, there really aren't those potential side effects of causing a die off of too many probiotics in the gut, or liver issues or kidney issues or something like that, which are rare anyways with short-term antibiotic use, but it's or pharmaceutical use, but where it's got a very good safety profile. It's to be perfectly frank, it's my preferred method to assess patients to see if there is some type of a microorganism afoot. Don't get me wrong, I really do like having the lab testing as well. I do think it is useful, but as I like to say to my patients, I'm not the one paying the bills on getting that testing done. So the conversation that I typically have with my patients around this is that these are the testing options, these are some of the limitations, the testing is useful, there is this therapeutic trial option as well, and then they can make a decision what they want to move ahead with. And as I also like to say to my patients, they're not mutually exclusive options. You can do both. I have patients who start the therapeutic trial while we're waiting for their test results to come back. Or I have patients where we do a therapeutic trial, and once we see whether there's a clinical response or not, and if we see like, oh, like you're feeling better, it's like, great. That if you want to do the testing now to try to figure out which microbe we're dealing with more specifically, that's great. You can do that too. Or vice versa, we can do the testing, and then if everything comes back negative for what we tested for, instead of going into it again and testing for additional co-infections that maybe we didn't test for the first time around, then we can always do a therapeutic trial instead. Because as I mentioned in the video yesterday, the testing that's available, it doesn't test for every species under the sun. So it might test for just Borrelia burgdorferi, or there are like the urine DNA panel does test for Borrelia burgdorferi, Miyamotoi, oh shoot, I'm forgetting now. It's been a little while since we ran one of those. I think maybe Guerini, I can't remember. Maybe Afzelii, I can't remember. But the long and short of it is that by doing a therapeutic trial, we're going to hit a broader range anyways, because the herbs that we work with, or certain other substances sometimes, they tend to be very broad spectrum. So that's the other advantage of using a non-pharmaceutical approach, at least as a therapeutic trial, in that the herbs are going to hit a broad range of different microbes. If you look at the work of, say, Stephen Buhner, who is kind of the definitive authority on the best herbs to use for treating persistent borreliosis and co-infections, in my opinion at least, when you look at the herbs that are, say, indicated for Bartonella, say an herb like Isatis, for example, well, it seems, and clinically at least, to have an anti-mycoplasma effect and an anti-Babesia effect, and it's a great antiviral. So it's just very, very broad spectrum. So using kind of a shotgun herbal formula as part of a therapeutic trial is something that I think covers a lot of bases, and then we can work backwards from there. So I'm a big fan of the therapeutic trial, but testing is useful too. So there's different things to consider when figuring out what to move ahead with in terms of assessment options.